So we're going to be using a special computer program to help me measure the temperature coming from your cervical spine. Basically, this is a big thermometer. So it has two probes that project an infrared beam that measures temperature. The body is symmetrical, which means that the temperature on the left side of the spine should be somewhat equal to the temperature on the right side of the spine. Well, if there's a misalignment of that top bone, it can throw off the body's ability to maintain balanced temperatures, and that imbalance is what I'm looking for here with my computer and the data that it shows me. Okay, so we're going to roll this from the top of your shoulders to the base of your skull and get 3 different readings, hopefully, but we'll see what we get. One more time. And over time, in the course of your visits, I get to collect a lot of data to let me know how well your body is functioning, how well the nervous system is changing, how it's adapting. Helps me understand when we need to do a correction and when we need to leave the body alone and let it continue its healing processes. So after that, then we kind of feel the cervical spine. We want to look for pain and tenderness in the top bone on either side or both sides. Then we assess range of motion. Feeling for a decrease or restriction in any direction, as well as pain experienced by the patient. Then we're looking for muscle spasms and tightness into the shoulders. And just seeing what types of indicators that we have that may lead us to know a little bit more about the misalignment that we're trying to correct for you. Now once we finish that, this is her second visit when we've done the initial exam already, which is a little bit more extensive than what I do on each and every visit after that. But I do the same routine as far as assessing the nervous system first, and then bringing her to the table and doing some more postural analysis, muscle testing, and nerve testing from that point forward. So I'm going to have Wendy come right here, and then you kick your shoes off over there for me, please. Good. Step right up face first. Ankles together, feet slid all the way forward till you feel the pad against your shin, and you can rest your hands right here, and the same on the other side. Relax everything, it's going to lower you down. 3, 2, 1. So from here, I'm going to be assessing and looking for cues and indicators and responses from some tests I'm going to be asking her to do. It's these indicators and these cues that I'm waiting for and listening to from the body that helps guide her course of care and my decision on whether or not to do a correction today or not. So here we're looking to see if her legs are even, and they are not. Her right leg is about 1/8 of an inch shorter than her left leg. Turn your head to the right, please. From here I can see what kind of tension is on the spine and see if turning her head in either direction causes her legs to balance or come even. It does not. Back to the center. Now turn your head to the left. And I notice difficulty in which position a patient may have turning their head. And now turning her head to the left causes her legs to balance. Back to the center. Notice difficulty and more distress turning her head to the left than turning to the right. That may also be an indicator of that subluxation or that misalignment. So now we're going to test a few things here. Gently raise both legs up for me. 3, 2, 1, and relax. Her right leg remains short. Turn your toes in together. 3, 2, 1, relax. Gets a little better. Squeeze the ankles together. 3, 2, 1, relax. Gets a little better. Bring the ankles apart. 3, 2, 1, relax. And gets a little better. So the only one, that first test, caused her legs to stay uneven, which is a test for the indicator for the C1 misalignment. So now, according to the images that I've already assessed and diagnosed, I'm going to test the body to see whether or not that's what the body will respond to the best. And it balanced her legs out when I tested that area. So now I'm going to counter test my findings and see if it makes things worse, and it does. So I have all the indications and indicators that I need to go forth now to correct the top bone in her neck, the atlas, and allow her body to begin to function better and remove whatever neurological interference is being caused by that hard bone pressing on a soft nerve. So, ready to get that done. Thank you.